So your doctor has told you should have a prostate biopsy. The question is, what does that mean and what can you expect? We do a much better job of performing a biopsy today, causing much less discomfort. The first thing to know is that your doctor may recommend you stop taking any medicine or drugs that might cause bleeding, such as ibuprofen or Motrin or Aleve. When you arrive at the doctor's office, you might be advised to take an enema, or you might be advised to take it even before coming to his office or her office. The enema will help make it easier for the doctor to see the prostate. Next, you'll be given an antibiotic because that can reduce your chance of getting an infection. You will then change into a hospital gown and lie on a table, and the doctor will insert an ultrasound probe into your rectum after providing adequate lubrication. The next thing is to provide an anesthetic, something to reduce the discomfort. Doctors have learned that injecting a medication called lidocaine can greatly diminish any pain you might have. Not all doctors do it, so before you even schedule a biopsy, be sure to ask your doctor whether or not lidocaine will be used to help reduce your pain. After that's been completed, with the ultrasound in place, the doctor will insert needles through the rectum and pass them into the prostate in different areas to sample different areas, because it's not always clear where cancer cells might be located. The biopsy passes a needle instantaneously into the prostate and then rapidly withdraws it. You may hear a popping sound. That whole process may take 5 seconds or less. But the doctor will take more than one sample. Usually 10 or 12 samples will be obtained, although some doctors still do less than that amount. The idea between doing 10 or 12 is it gives a better chance to sample the entire prostate gland. But remember, this is like searching for a needle in a haystack. So just because a biopsy comes up being negative does not mean that cancer is absent. It simply means the doctor didn't put the needle in the right place. So even if you have a negative biopsy, your doctor is going to recommend that you have careful follow-up to make sure that a cancer wasn't missed. Now, there are risks from having this procedure. A small number of men may have significant bleeding, requiring hospitalization and sometimes even a transfusion. Despite getting an antibiotic, there's also a risk of getting an infection. And if you should develop fever or any other symptoms suggesting an infection, be sure to call your doctor urgently and not wait until the next morning, because sometimes it's necessary to be hospitalized with stronger antibiotics given. In the end, though, this is a relatively small procedure, and most people tolerate it very well without having too much pain or discomfort.